Hi, my name is Dr. Ron Holt. I'm a board certified psychiatrist. I live in San Francisco, California, where I practice as a student health psychiatrist at a large university. Recently, was contacted by my undergraduate school in Nebraska saying, a lot of our students seem to be struggling with mental health issues during this coronavirus, and we're wondering if you could give us some tips that we could maybe pass along to the students. And so I thought, well, if kids in the Midwest are struggling with this too, as far as college, then maybe other students might be struggling as well. And so I thought maybe I'd just put this little video together to see if I can maybe pass some tips along to you to help you in your journey as we go through this coronavirus together. And so just to tell you a little bit about San Francisco and how we're practicing to be safe is we've been in shelter in place now, gosh, for I think about 5 weeks. It was in mid-March when we had shelter in place orders put upon us. And basically that just means that we should not be leaving the house unless we go out for a walk somewhere locally in the neighborhood, certainly practicing social distancing when we do that. And when we do go out, we are required to wear masks now as well when we go to get essential services, such as going to a grocery store, maybe going to a doctor's office, or whatever else you would consider being essential. The other thing that they're really encouraged us to do is to stay indoors and also avoid crowds. And for those who are able to work remotely, they're strongly encouraging us to do that. And so far that's been working for us. We have been flattening the curve, but that's what we're doing right now to take care of us here in San Francisco. And so one of the other questions that was asked of me was, it seems like a lot of students might be struggling with mental health issues during this COVID-19. And do you have any tips on that? And so I looked up a survey that was done by the American Psychiatric Association that was done, about last month. And they said that almost 1 in 2 people that took the survey were seriously concerned about getting the virus. I mean, that's a large amount. And over half, well over half, were very anxious that maybe a family member or a close friend would come down with the coronavirus themselves. 1/3 of them, which is pretty a large percentage, 1/3 were greatly concerned about how this was going to impact their mental health. And a majority were worried about finances and our economy in the future. So we can clearly see that this coronavirus is giving us a lot to think about and is really starting to affect the psyche of a lot of people and their mental health. So what are we going to start seeing? We're going to see higher levels of stress, higher levels of anxiety and worrying, and probably some symptoms of depression as well. In fact, in the study that they did last month, they found that almost 20% weren't sleeping as well because they were worried about the coronavirus. And 1/4 of people, the only thing that they could really think about was the coronavirus itself. And so we can see that this is going to be causing us a lot of distress in the months and years to come after this pandemic has run its course. The other thing too that they asked me about is that they said, this pandemic, how more specifically might it affect students like med students, college students, professional students, and maybe other students as well? And first of all, what I want to say is how horribly I feel about these kids who are graduating from, whether it's college or high school or medical school or graduate school, whatever school that you're graduating from, how horrible it must be to graduate and not be able to walk or do the ceremony like what most people do when they graduate. It's really sad because I think that the coronavirus is going to be around for a while, and so a lot of graduation ceremonies have been canceled or at least postponed. And so a way to kind of work through that is, perhaps maybe you could walk the following semester or walk the next year, with people. The other option is to maybe have some kind of celebration online, doing a Zoom program where you have family and friends join you to help celebrate your graduation. I know that there are some people that are doing things outside, of course, practicing social distancing, but maybe doing things outside where they're able to celebrate, remotely. And so, there are ways to kind of work through that, but that is something that is on the minds, I think, of a lot of students. The other thing, too, that I think is really bothering students is remote learning. It's great that colleges have been able to switch over as quickly as they have from doing face-to-face interaction to doing remote learning. However, that's a big adjustment. It's a big adjustment for the faculty and for the students as well. And there are some of you students out there that probably don't have the resources or maybe Wi-Fi or a computer the way that others do. And so it puts you to a disadvantage as well. And so my recommendation would be, if you're doing remote learning and you find that it's more difficult for you to learn or you don't have the resources in which to do it, please reach out to your school, reach out to your faculty, reach out to maybe your dean on call and say, hey, listen, I'm really struggling here academically. What can I do to get through this and to get the kind of grades that I want? Because please don't feel like you're alone, because you're not. There are resources that are available, but you just have to reach out. The other thing too that I think is really sad is that in school, in college, for instance, it's not just going to classes face to face, but it's the social interactions that we have, right, with people in clubs, or maybe we're doing sports, or maybe just classmates that you become really close friends with, and all of a sudden that's been kind of taken away from us when we're all having to do remote learning. And so my recommendation on that is, pick up the phone and talk to your friends that you miss from school. Or if there's a particular club that you really liked at school, maybe get online with the faculty and say, hey, listen, can we do a Zoom club together? Because I'm really missing having my club members to kind of collaborate and kind of work through stuff. And so, either picking up a phone or doing texting or doing video chats or doing Zoom, I think all those are great ways for you to kind of get reconnected with your school while we are learning remotely. The other thing too, which is just disheartening, is that I know that millions of students have had to leave campus because they didn't want to be in the dorms for safety issues due to COVID-19, and that totally makes sense. But for some of you, that was a big loss, right? Because you not only did you lose housing, but perhaps you lost the ability to get food because you were eating it in the campus cafeteria, or maybe your dorm's cafeteria. And so those are really tough things. And so if you find that you've had to leave and you're having problems, say, with food, certainly I'd reach back out to the school and say, what kind of resources do you have available for me? I know a lot of schools know of resources as far as at food pantries, other resources that they may be aware of that you don't. So certainly reach out to them. Also, maybe in your community, Google and find out what kind of resources are available as far as food pantries where you now live. I don't want you to feel like you're alone, and I certainly don't want you to go without food. And so it's really important for you to reach out for services. We're all in this together, and there's nothing wrong with reaching out, asking for help. The other thing that I think is really happening to a lot of students as well, just like there are lots of other people, is unemployment. I just saw the stats this morning that there were, I think, 4 more million people who applied for unemployment benefits. So that brings us up to 25 million people who are now unemployed. And, I'm really sorry that if that's happening to you, and if it is, please reach out to your state's unemployment office and see what you can do. I know that Congress has passed some bills to kind of help us and help people who have lost their jobs have some resources and money coming in for them. And so by all means, if you've lost your job due to this COVID-19, please reach out to your state's unemployment office. They can really help you out. Okay. And the last thing too, that I think how it really impacts students is that I know a lot of students, when they first go to college or med school or wherever it is that they're going for studies, they may have been getting their student health services through the school. Maybe healthcare, they didn't have that option before they actually went to college. And so some of you have lost that as well. And I'm really sorry that it's happened to you, or maybe you're just able to do telemedicine with your providers back on your campus. And so what I'd recommend doing is, if you're under the age of 26 and still under your parents' plan, by all means, use your parents' insurance to get connected with people, with medical providers in your area. And also, if you don't have that, or you're older than 26 and you don't have coverage, contact the school, the student health services there, and say, I realize that I'm not on campus anymore, but I've still paid my student health fee I'd like to have some telemedicine. And so I think they would be willing to work with you as well. And so the bottom line is that all these things that we're all going through together, it's kind of like a mourning process, isn't it? I mean, we were used to this life, and it was a great life for us, and we were really learning a lot in school, and we were meeting friends and doing all sorts of activities, and all of a sudden that's been taken away from us. And so everything now has kind of changed. And so there's nothing wrong with mourning the old life that we had. And then eventually we're going to have to embrace the new life that's about to come our way. And do we know what our new life looks like? No, not really, not yet, but we will. But we have to embrace the new now. And so it's okay to mourn, and it's a normal process. And I don't want people to think that it's not okay to not be okay, because we're all in this together, but we will persevere. So other things that were brought up that I think was probably good to touch base with is, a lot of students now are all of a sudden they're kind of trapped in their homes. And I was asked about what do you think about, are there any tips for people who might be experiencing cabin fever? And sure, the answer is yes. And, yes, we are practicing social distancing, but another way to look at it is that we're practicing physical distancing, right? Where we're not able to be within 6 feet of other people unless we live in the house with them, in order for us to keep ourselves and others safe. And so I think having remote contact would be very helpful. I realize that you may be cooped up in the house, but you still have your cell phone, right? Or you still have your tablet or smartphone. And so calling somebody or texting someone or doing some video chats, maybe even a Zoom call with a couple of friends or buddies can go a long way. And I really hope that you will consider doing that. Also, too, when we sit there in isolation and kind of ruminate and obsess about what's going on, it can put us into a bad space, right, emotionally. And so nothing wrong with picking up the phone and calling a friend and say, I'm really struggling right now, and I kind of want to work through this with you. And a lot of times there is comfort in knowing other people are going through this with us. And so if you have a good family member or friend that you can reach out to and talk about your feelings, I think that would be very helpful. Go for a walk in the neighborhood. I think that would be very important as well. Daily walks could be great. It helps clear our mind. Helps us kind of clear our minds, going from the anxiety part of our brain coming up to the prefrontal cortex, which allows us to think more clearly, be more hopeful. And if you can go for a walk even once or twice a day, that would be great. So my caution is that when you do go for a walk, please practice physical distancing. At least give yourself 6 feet from other people. And if you're walking by others where you aren't able to get that 6 feet, please wear a mask. But by all means, try to do your best to give yourself the distance that you need, because I want you to be safe, and I know that you want to be safe as well. And lastly, too, we talked about this a little bit earlier, but if you've got a club on campus or say a sports team or something, and you're really missing out, there's nothing wrong with like doing a group Zoom call. We can all kind of connect together and talk and work through this, because there is safety in numbers, and being able to talk through stuff makes us realize that we're not alone. And I want you to know that you're not alone. And so those are ways of things that you can do to kind of work through cabin fever. So other questions is, some students have been experiencing some anxiety because of this COVID-19. And so how is it that we can kind of work through that a little bit? And so here's some tips for it. So, it's normal, actually. It's normal to have fear about the unknown, right? And COVID-19 is still a lot unknown to us. And so it's frightening. However, when that fear turns into obsessions or ruminations, or that the only thing we can think about is that, then that's when anxiety can kind of set in for us. And then anxiety can start to cause us functional impairment in everyday living. And so we try to want to kind of avoid that. And so ways to kind of help deal with anxiety, one of them is exercise. I mean, studies have shown that mild to moderate exercise can help with mental health issues. And so if that's something that you can do on a daily basis, I'd highly recommend doing it. I realize that a lot of us don't have access to a gym right now, but we can certainly go outside and go for good walks, or maybe run some stairs, as long as we do practice social distancing. The other thing, too, that we have talked about to help relieve anxiety is reaching out to people remotely. That would be very helpful. So sometimes taking some deep breaths. I know that our amygdala, which is the part of the brain that brings up our fear, can be alive and well right now during the coronavirus. And so sometimes taking deep breaths, breathing in and out, and just focusing in on that breath, not on anything else, just focusing in on that breath can sometimes go a long ways for us. And so it'll take us out of that fear center and take us into the prefrontal cortex. It allows us to be relaxed and be more focused on and focusing on things that are healthy. So taking deep breaths whenever you can would be very helpful. Practicing gratitude would be a great idea as well. I wake up in the morning and I think, gosh, there's so much that's going on in this world right now. How are we ever going to get through this? And then I think, let's think about things that I'm grateful for. And that was like, I have food, I have clothing, I have shelter, I have my health. I have the ability to go outside and go for a walk. I mean, some people don't even have those basic necessities now. And so I think each morning it's a great idea to wake up and just think about things that you're grateful for. Even maybe writing them down would be helpful as well. The other thing we need to think about is sometimes people say, I have a lot of fear and I don't know how to necessarily deal with this. And sometimes journaling can sometimes help, where we kind of write down our feelings and that kind of gives us permission within our mind to let it go. And so it's not uncommon for people to do journaling every day, just to kind of let go of those feelings that they have internally, put it externally, and then they can move on with their day. The other thing too is kind of reframing our thoughts. I've heard some friends and family say, I'm so upset that I'm not able to go out. I'm so angry about this. I wish that this wasn't happening. And, a way to kind of reframe it is say, I feel so grateful that I have the opportunity to stay inside, because that's protecting myself and it's protecting other people as well. And so it all depends on the perspective that we come from. If we come from negativity, that's how we're going to feel internally. But if we come from a place of love and safety and say, I really am grateful that I have the opportunity to stay inside to protect myself, I think that's going to go a lot further, and it's going to help you a lot more with your mental health as well. The other thing too is getting into a routine. I know for myself, it was really hard for the first few days when I wasn't working as much, that it's easier for us to stay up later. It's easier for us to, sleep in. It's easier for us to eat junk food and not really do things that we normally did. And I think it's really important that we do have a routine and we do it daily. So for example, get up at the same time each day, shave and shower, or whatever it is that you would normally do as if you're going to face-to-face school. I think having a routine in place and a schedule will make us feel better and will trick our brains into thinking that we are in some kind of normalcy, and that will help you get through this as well. Getting a good night's sleep is so important. I can't tell you enough how important that is. So try to keep a regular schedule where you go to bed around the same time and get up at the same time. So, eating well, connecting with others, having a sense of purpose, in sleeping, those are really the 4 pillars to kind of help us live our best lives right now. So, something else that was mentioned to me, which I'd like to talk about, is some people have this fear and anxiety, which is compounded by the digital age in which we live. And so, do you have any suggestions for students on how to maneuver through misinformation? And so, yes, I do. There is a lot of misinformation out there, and there's a lot of news sources that are saying various things. And I think when we hear a lot of different types of information from various sources, that actually makes our fear and our anxiety worse. And so here's my recommendation on that is just practice, just follow the news that's practical news. And so, for instance, like the Centers for Disease Control, the cdc.gov, they have an excellent resource. And I actually look at that each day, just go online to cdc.gov, kind of check out the latest things that they talk about. I usually do that earlier in the day, and then I kind of let it go. I think trying to get information from all different sources, whether it's doing things like cable news or social media posts or stuff on Twitter or just things that you hear from friends or family, everyone seems like conflicting information, which can make our anxiety and our stress and fear worse. And so I would totally avoid doing that. I wouldn't watch the news beyond 6 o'clock at night, because that can kind of get you to obsess and worry. So I think getting your news from a reliable source such as the cdc.gov, and then just kind of not getting information from other people the rest of the day and not really rehashing what other people's opinions are about it, I think will go a long way for you. We're in this together, but we also realize that we need to take care of ourselves as well. And I think getting a limited amount of information from a reliable source is the best way for us to get through this. And so another question that was brought up to me, which I think was very good, is, currently there are some students that are quarantined with families which they may not be close to, they may not feel accepted or supported by. And they asked, do you have any specific advice for these students? And, yes, I do. And first of all, for those of you who are back into an environment, say you were in the dorms and now you're back home, and the environment doesn't feel safe for you or doesn't feel supportive, I'm sorry that you're going through that. It sucks. And so something that you may want to do is, if you're having issues with your family or your parents or siblings and people are arguing, you can just come from a place of love and say, mom and dad, I love you. And I realize there's times that we struggle together and we fight, but I'd like to kind of get through this together while we're in this pandemic. And so what is it that we can do to make the lives easier for each other so that we can get along? And I think when you come from a place of love and say it that way, they're much more likely to respond to you as opposed to becoming defensive. The other thing too is that if you have a safe place that you feel is safe for you in the home, call it and say, you could say, family, there's times that maybe we don't get along. And so I just want you to know that I feel like my bedroom's a safe zone. And so whenever I feel like I need some space, I'm going to go back there, and please respect that. And so I think that would be helpful for people as well that don't feel like they're in supportive environments. The other thing too is, reach out to people that are supportive of you. If you don't have like a place in the home that feels safe, maybe go out for a walk and maybe contact one of your friends, or contact your advisor, or contact a faculty member back on campus, someone that is supportive of you. That can go a long way. I don't want you to feel like you're alone, and you don't have to be. If you don't feel like you're being supported by family, there are other ways that we just talked about that you can reach out to others to get the support that you need. There's a federal aid agency called SAMHSA, which is available online. And they also have a hotline that they started that is a distress hotline that's available 24/7. And it's available for people who are dealing with stress, such as around or because of the coronavirus. And their phone number is 1-800-985-5990. That's 1-800-985-5990. And so certainly if you're feeling distressed, please reach out to them. They are available for you. If you're experiencing domestic violence, or you don't feel safe in the home, you feel like you're being verbally or physically abused, I'm sorry that you're going through that. The government also has a national domestic violence hotline, and I certainly won't want you to call them. It's 1-800-799-SAFE. That's 1-800-799-SAFE. And, I realize that there are some people out there that are maybe lesbian, gay, bisexual, and trans, and they happen to be out in college, but now that they're back in the home, maybe they're not out to family, so they have to go back into the closet. Man, that's tough. I totally get that. And so I don't want you to feel like you're alone either with that. If you're struggling with your sexual orientation or your gender identity, or feel like you're not being supported, please contact the Trevor Project. And their phone number is 1-866-488-7386. That's 1-866-488-7386. And, lastly, the other phone number that I think is really important too is the National Suicide Prevention Lifeline. And that's available 24/7 as well. And their phone number is 1-800-273-TALK. That's 1-800-273-TALK. And what I'm going to do is I'm going to go ahead and have these phone numbers at the end of this video today, so that you don't have to write them down now, but they will be available to you. All right. And so a couple of other things that people say, well, what should I do to keep myself safe? And so, I think maybe following the guidelines that we follow here in San Francisco would be helpful. I think we're going to be in this virus for quite some time. Studies and people that I've been seeing on the CDC and other scientists are saying that we're probably not going to be over this COVID-19 until we have a vaccine and everyone's been vaccinated, and so that may put us into 2021, and so we may be having to practice some of these guidelines for the rest of the year, and so that seems tough and it seems stressful. But if you just think about what it is that you can do to protect yourself, that's going to help lower your anxiety and lower your worry. And so, for instance, like we'll just go over it again, practice social distancing, have at least 6 feet between you and someone that you don't know. When you're out in public and you're in essential services like a grocery store, wear a mask. Avoid crowds, and by all means, wash your hands whenever you feel like you've been exposed. The thing that I want people to be very careful about is please be extra cautious that when they start saying that they're going to start reopening the country, be very careful, because I think that until we have a vaccine, there's possibility that we're going to have future waves of this virus. And so we need to really be careful and open up very slowly. And so I would just caution you that when things do start opening up, please take all the precautions necessary until several weeks have gone away and they have not seen an increase in cases in your area. Okay. So, this is a great one too that was brought up to me, which I think would be helpful for people, is that, are there any specific behaviors or behavioral changes that we should be on the lookout for now that we're quarantined with our family back at home? So, for example, maybe we're seeing that our family members or our parents or even ourselves are struggling with mental health issues. And so what changes might you see in them behaviorally that would make you say, you know what, I'm going to reach out to them because it seems like maybe they're not okay. And so, sometimes this fear can turn to anxiety, and it can turn to depression, and it can also sometimes make a person self-medicate, like using drugs and alcohol. And so things to look at as far as depression is maybe symptoms such as a person sleeping too much or maybe not sleeping enough, having their interest level go down, like they used to be motivated to go for walks, they used to be motivated to learn online, but they're not doing that anymore. Maybe you notice some changes in their energy where they just say, I just don't have the energy to do things like I once did. Other things too is that maybe they complain about their inability to focus and concentrate. That's a symptom as well. So sometimes when we have depression, we either eat too much or we eat too little. And so if you've noticed appetite changes in them as well. And lastly, sometimes when people are feeling depressed, they can actually have thoughts of self-harm or having thoughts of being better off not alive. And they may actually voice those like, well, what's the sense of being around? We're going to be in this forever. And so those are kind of some symptoms to kind of look at when someone may be struggling with depression. The other thing is that sometimes our fear, if it goes unchecked and we start to obsess and ruminate, that can lead to anxiety. And anxiety can be overwhelming and it can cause us functional impairment just as much. And so if you see somebody ruminating and saying, the only thing I can think about is about this COVID-19 and I don't know what I'm going to do, that usually then is probably causing them some functional impairment. And so if you start noticing symptoms like that, you can always come from a place of love and say, Mom and Dad, I love you, but it seems like you're not like your normal self. And I'm wondering, is there anything that I can do for you? And so, they may say, gosh, you're right. I haven't been feeling myself. Thank you for recognizing that. I thought it was just me, but I guess others are seeing it in me as well. And so when a person can have it brought to their attention, they may or may not know it themselves, but when it's brought to their attention, then they can get the appropriate services that they need. And that may be reaching out to their primary care doctor through their insurance, or reaching out through their local health department, or if you still have services at your college, you can contact your student health provider there to get the services that you need. The other thing too is that sometimes we can self-medicate where people start drinking more alcohol, or maybe they might even start doing drugs as a way to cope with all this stress. And so if you notice that as well, there's nothing wrong with reaching out to them as well and just say, I've kind of noticed that you've been drinking more than usual. Is there anything that I can do for you? When you come from a place of love, trust me, it's going to go a long ways, and people are not going to become defensive. They're going to listen to you, and they're realizing that you are there for them. And so please reach out to them because we are all in this together. Okay. So in closing here, a couple of things. What would be a kind of a couple final things I'd want to say to you is that, you know what, we're in this together. We will persevere. You are not alone. And if you need to reach out for help, please do so, and please stay healthy, and please be well. Anyway, I hope that this video has been helpful for you as you navigate this COVID-19 while being a student. Okay, thanks a lot. Take care and be safe. Bye-bye.